Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about if you are monocular, can we help you in therapy? Now, we have talked about this before, but it came up and I think it's a great thing to discuss again. And so we're going to go into that and dive a little bit deeper. But first, I want to tell you how you can connect with us. If you're local, you can give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com and you can do one of two things. You can either schedule a consultation or you can fill out a questionnaire and get some information back about what's going on with your vision. Now, let's talk about if you're monocular, which means that you only have one eye that has usable vision for whatever reason. Maybe it's been an injury, maybe there's been malignant melanoma and the eye had to be removed. Maybe there has been some sort of a virus that attacked the optic nerve and it caused significant loss of vision. There can be multiple reasons why someone ends up being monocular and only using one eye. Now, if the potential exists for the other eye to gain sight, that's slightly different. We might be talking about more like an amblyopia where one eye just doesn't see as well and it needs to be improved. But in this case, I'm truly talking about a person who is monocular. They only have the option of using one eye. Now, what do we do to help that individual? Well, it's really interesting because there are quite a few things and techniques that we can teach you. For instance, we can teach you how to be spatially aware of your surroundings. We can teach you how to scan, how to fixate and follow information so that you can not only see better but see your environment better. We can improve clarity of your eyesight, maybe reduce a lens prescription. But one of the things that I find to be most helpful is teaching an individual two skill sets. One is awareness of surroundings, which includes their visual field enlarging. And the way that we do that is by using photosynthetics or light therapy and triggering your brain to process more visual information all around you. Now, what's interesting is the individual who's monocular, their brain can kind of learn how to grow a larger visual field than normal, almost to compensate and make up for the fact that they only have one eye to be able to get viable information from. And that's a real tremendous blessing. It's a real unique quality that the brain is able to kind of gain a larger visual field to compensate. The second skill that's really important to teach an individual who's monocular is maybe how to judge their depth and cues of depth perception or the ability to kind of judge distances. Now, normalized depth perception only occurs if an individual has two eyes that can sync up to a target, provide binocular or two-eyed cues that the brain can then use to decipher how far away something is. That's normalized depth perception. In the case of someone who's monocular, we can teach monocular cues to understanding depth. So it's slightly different. But in these cases, we want to train someone how to be able to judge space well. So if you're wanting to go to a party with friends and you don't really want them to know that maybe you only have one eye because of an accident and maybe the other eye had to be removed. Maybe even you have a prosthetic, or maybe just the vision is so poor in that eye that it's not viable to ever be using it again, and you only have one eye to be able to see clearly with. You want to be able to function in a way in which you feel as though everything's kind of normal for you in terms of your vision. You don't want to function in a way that you're knocking things over. And many times our patients come to us out of a sense of they don't want to be embarrassed or they don't want to feel like they're different, even though they've had this maybe a loss. And that's something that we can train you to be able to do, is to be aware again spatially of your surroundings, your peripheral vision, your eye-hand coordination, and giving you the ability to assess things with what we call monocular cues to depth. This is really important, again, so that you can reach and grab something with ease, comfort, knowing that you're not knocking something over, or shopping in the grocery store or somewhere where you go to grab something but maybe you hit it and you knock it off instead. So in order to become more accurate with those things, there are various ways that we can train you to become accurate. Now, you're watching this video, and maybe if you've gotten to this point, it's either you or it's someone that you know that's having to deal with this new life. Maybe they didn't anticipate that this is what was going to happen to them, and whether or not this is something that you were born with, maybe something occurred as an injury, or something has happened tragically and you've had to deal with it, and now this is the life that you have. You just have to know that there's actually hope, and that there are many things that we can do to train you how to have better vision, even if it is only monocular. It doesn't have to be only monocular as though you're giving something up. It can be the best of what you can have, and it can truly be like a gift of new vision. Now, if this is you, give us a call. Our phone number is 618-288-1489. If you're not local to us, though, you can go to our website at visionforlifeworks.com, and you've got two options. You can either click on the schedule a consultation, or you can fill out a questionnaire and get some feedback about what's going on with your vision. If you like the video, hit the like button. Obviously, pass it along if you feel like it could be beneficial to someone. And if you haven't done so already, please subscribe to our channel to get all of our videos. Thank you.